Nearly 20% of claims denials is related to medical notes errors, or should I say documentation errors. There is a lack of documentation supporting the visits. So auditing now, they are give us the opportunity actually to correct some notes. If you're doing pre-payment audit, which is my favorite, so we can fix it. But when it comes to after payment audit, it usually happens 2 years after the visit or closer to 2 years after the visit. So this way you are not able to correct the claim or to correct the notes. You still can correct the notes, but it's too farther away. So you wanna, be proactive, have your notes ready, have your notes proof, passing those auditings. Per CMS, any service that you provided at the office, the medical notes is the only documentation that supports your service. So if you didn't write down, did not happen for the payer view. That's why I'm giving you 5 quick tips to help have strong notes and bypass those auditing. Number 1, select a specific diagnostic. There is still a lot of doctors out there select unspecified diagnostic. However, with the change of ICD-10, which was a while ago, the insurance want more and more details on those diagnostics. So when you select your ICD, make sure that you pick the one that has the further explanation for the service. For example, if you're doing pain, a simple one. So don't put pain unspecified foot. Make sure that you have the specified pain for that patient's condition. Even if you're choosing bilateral, make sure that you select pain on the right, pain on the left, but avoid unspecified altogether. Tip number 2, when you're treating wounds, make sure that you document the progress measurement of these wounds. Payer, they want to know how effective is the treatment that you're providing. So we can easily send all the previous medical records since the patient starts, and then showing through this stack of papers, all these visits. The auditor going to flip the notes after note to make sure how is this wound progressing. Or you can facilitate it for those auditors by put on your notes, make sure that you have the track of the wound measurement from previous visits. Let's say patient came at 10 visits, you put visit number 1, whatever date, and wound measurement, drainage. Number 2, the same visit, and then you keep it tracking of it, and you just copy for the next note, and you added the last one in there. So this way, it's facilitated. The payer will clearly see how effective is your treatment and will support your continual care. Tip number 3, document thoroughly. So give more details as possible of this service that you provided. For example, if you give a debridement, so on this debridement, you want to give more specific of what did you debride, the area, the size, location that you debrided. So more information you give, best, for supporting your notes. A tip it is, on your template, you can have your techniques that you use that will help you. So you describe the techniques for each service that you provide, and you have it. And one way to use, we like Encoder. So if you go to Encoder, for example, or any American Association coding book, then they will describe you what is this procedure, how the doctor performed the procedure. So you can use that as a template to help you explain how you did that service, give you more complexity to your service. Let's say if you only write debridement done, or suppose you did debridement, the technique that you used, the area that you debrided, you clean the area. So you give more specifics so that you show the complexity of a service, and will support, the service you provide even better. Tip number 4, avoid cloning notes. So we use a template. We just talk about templates. Template is phenomenal, helps doctors, but do not just copy and paste those templates. Make sure that you customize it for this patient specific, treatment room. make sure that you have specific nuances for each patient, because when the audits are gonna come and they're gonna ask you for a range of notes, and what they see is exactly the same description for every single visit, for exactly the same procedure you're doing. For example, if they analyze your routine for care and they see exactly the same description for 10 different patients, they will question, the accuracy of their notes. So you make sure that you add these notes and put specific nuances for that patient, for that visit. Tip number 5, sign your notes. There are so many doctors, they do not sign the notes, and they just, because they want to make sure they didn't forget anything, or they want to make sure that they are ready for the audits and the note will pass the audit, so they wait to sign right when they get the auditing notification. My advice for you, do not do that. Tell you why. We were going through auditing, and this doctor did exactly this: sign before the audit and make correction the note, make sure the note supported. However, the Medicare audit was questioning, how can this be accurate if the doctor saw this patient over a year ago? However, he signed these notes, a week from you handle me this. So the audit was not trusting this note accuracy. What's happening is they're going to ask for more notes. They keep asking for more notes. They want to look further in these doctors' care. So I look it up in Medicare CMS guidelines for when the doctor should sign the notes. And the guideline says the doctor should sign the notes with a reasonable time after the visits. Pretty subjective. So it does not give any specific time when the doctor should sign. However, it does specify, because they know it's subjective, they consider a couple of days after the visit to be reasonable. Saying that, so make sure that you sign and review your notes, have everything in place within a week after the service. That is the best. So one raise eyebrows from an auditors, and will not keep you pushing them to look further more notes and question your accuracy. So there you have it. Here are 5 tips to make your notes more supportive and bypass those audits and retain your money. If you'd like help streamline your billing process and reduce denials, we are here at ParaDocs to support you. Just learn more about us at our website, ParaDocsMRC.com, and then reach out. We are here to help you. Thanks for watching, and here's for getting paid faster and stress-free.